How long does swelling last after Asian double eyelid surgery?
Swelling after Asian double eyelid surgery is one of the most common concerns expressed by people considering this procedure. The purpose of Asian eyelid surgery is to create an eyelid crease which isn't well defined or absent. It is common to have the appearance of a higher eyelid crease than anticipated soon after surgery. I'll explain what exactly causes swelling after Asian eyelid surgery and my approach to minimize post-surgical swelling. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I specialize in all types of cosmetic eyelid surgeries, such as specialty focus on Asian double eyelids, as well as hooded eyes, under-eye bags, and specialized procedures like eyelid ptosis, upper and lower eyelid retraction. I also perform corrective or revision surgery for complications of procedures originally performed by other doctors. In my experience, a significant number of Asian eyelid surgery patients who had their surgery done elsewhere contact me to express their concern that their creases look too high after surgery. This applies also to my own patients who are also concerned that their eyelid creases look too high soon after surgery. The explanation for this phenomena is that swelling between the eyelid margin and the crease creates this type of appearance. As swelling diminishes, the crease level looks more natural. The first thing I do as a surgeon to reduce swelling after Asian double eyelid surgery is to perform the procedure in a way which minimizes trauma and swelling. I do this by performing the surgery with local anesthesia and light IV sedation. This allows for more control over the anesthesia-related swelling, which could occur more frequently with general anesthesia caused by coughing and postoperative nausea and vomiting. The degree of swelling and how long the swelling lasts is affected by the type of double eyelid surgery performed. For example, the incisional method of Asian double eyelid surgery typically involves removal of excess fat that prevents an eyelid crease from forming, as well as excising redundant or extra skin if necessary. Once excess fat and skin is removed, the upper eyelid skin is attached with sutures to the levator muscle and then the lower part of the incision. The levator muscle is the muscle that lifts the eyelid, which is like the word elevator without the first E. It is the connection between the eyelid skin and the levator muscle that creates the eyelid crease. If there is no redundant skin or excess fat that needs to be removed, typically seen in younger people without an eyelid crease, then I perform a procedure called a non-incisional Asian eyelid surgery. I do this by creating small openings in the upper eyelid to pass sutures to connect the eyelid skin with the levator muscle in order to create the connection between the skin and the levator muscle to form an eyelid crease. Generally, I find that there is less swelling after non-incisional surgery in comparison to the incisional method. In the first 2 days after surgery, I advise my patients to use cold compresses on the eyes to be applied on a schedule of 20 minutes on, 20 minutes off while awake. During the same period, when applicable, I have patients use antibiotic ointment for areas where surgery was performed, such as the entry points of a non-incisional procedure or the sutures after an incisional procedure. After the first 2 days, I encourage my patients to be moving around and encourage them to talk and smile. I also recommend when they are not active to use warm compresses to enhance the circulation. After the third day, I also advise patients to switch from antibiotic ointment to a petrolatum-based ointment like Aquaphor. This reduces the potential for contact allergy from the antibiotic while providing a moist environment for optimal healing. Prolonged use of an antibiotic ointment can actually lead to more swelling due to a contact allergy. This can be misinterpreted as an infection, which motivates the patient to apply more antibiotic, creating a vicious cycle of worsening the allergy and causing even more swelling. Following postoperative instructions is important for optimal healing and clearing of swelling. Sutures are usually removed at 5 to 7 days after surgery. In my opinion, the swelling between the eyelid margin and the eyelid crease in Asian eyelid surgery is due to a compression effect that is unique to this type of surgery. In non-Asian upper eyelid surgery, it's less common to have the same level of swelling in this area since the skin is usually not sutured to the levator muscle in the same way as it is in Asian eyelid surgery. The first month of healing for any surgery is referred to as the proliferative stage of wound healing. This is a time when new collagen and blood supply is being created. After the first month, the remodeling stage of wound healing begins, where collagen becomes more organized. Swelling diminishes significantly, and at the 6-month point, the appearance is typically stable and consistent with the originally expected outcome. I regularly follow my patients at specific intervals, which are close together during the first 3 to 6 months after surgery, to monitor progress and to answer questions. Many patients actually look very good in only a few weeks. Age and extent of surgery are variables which do contribute to the recovery period. Swelling, which creates a perception of the eyelid crease being too high after Asian eyelid surgery, can be distressing. Optimal surgical technique, anesthesia, and aftercare can minimize the swelling and the time it takes for the swelling to resolve. A skilled and experienced surgeon can guide you through the aftercare process so you can achieve the outcome you want. I hope you found this information helpful. Thank you for your question.